morning, everybody.
Good morning.
Good morning, good morning. I'm glad to thank you for responding so that I know everyone can hear me okay. Welcome to our November HICP meeting. Happy first Friday in November. It's been, I think, a very eventful week and continues to be so. We have obviously a lot going on in our communities these days and across the nation. And it's a wonderful opportunity for us to spend some time together and talk through the issues that are of greatest importance to our residents, to our communities, our small businesses, and how we collectively can help forward a progressive agenda for our community and our neighborhoods. So with that, I'm going to go ahead and kick us off with the November meeting. Please note we have some highlighted tech tips for Zoom meetings that we'll just kind of keep reiterating to keep everyone together. We do ask that you please mute yourself unless you are speaking, but we do allow everyone to participate fully in these meetings. So we're very excited to have your full and active participation. Please feel free to use your screen controls so that you can join us in the conversation. You can take a look at the number of participants and the names of who's in the meeting with us. You can open up a shared window for chat and type in your comments throughout the presentations. It'll be a great way for us to catalog questions you may have during the middle of the presentation that we can come back to later. And it also creates an opportunity for dialogue between the members of our HICP partnership. We also have simultaneous translation today in Spanish. If you would like to access that, please take advantage of the globe at the bottom of your screen and where you can pick the language of your choice. Dalila, would you like to provide the welcome in Spanish and just very quickly, direct people to the translation option?
Buenos días a todos. Como recordatorio, tenemos un servicio de interpretación abajo con el glóbulo. Por favor, seleccione la sala de español. Algunas de las reglas que tenemos que voy a repasar a participantes. Por favor, se quedan en mudo. Si tienen alguna pregunta, pueden alzar la mano a la opción. Se dice raise hand. Si quieren hacer un comentario en el chat, se puede hacer abajo. También todo eso está abajito de la pantalla. Y ya es todo. Bienvenidos y gracias por estar aquí con nosotros.
Thank you so much, Dalila. So as mentioned, we are excited to have a robust conversation with you all. We want this to be active dialogue as the presenters are making their comments. Please be prepared with questions and comments and reflections so that we can have that rich conversation we look forward to so much every month. We can use the chat, we can raise a hand, and we will call upon you, and we'll make sure that we give good time and space for questions and commentary throughout the meeting. With that, I'm going to kick us off with a review and reflection on the guiding principles of our meeting table. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious, and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. So for today's meeting, we have several wonderful presenters and presentations in front of us. We're going to spend a few moments on election reflections. Obviously, that has been, I think, a very dominant feature of the conversation over the last week. So it's interesting to reflect upon what this means for us as a community, both local and national. We also have some announcements and partner sharing opportunity. Then we'll have an update on our campus projects, as well as the LAC-USC Medical Center. And then we're going to move to the bulk of our presentation where we really reflect upon mental health and wellness under these COVID times. We're going to have a commentary from a community resident on her reflections on what is happening at the ground level for our community residents. And then we're going to spend a bulk of our time today with the Department of Mental Health, who will be guiding us through some reflections about how to stay well and what resources are available to us in the community to help shore up our mental health and wellness during these very stressful times. So with that, I will invite my colleague, Rosa Soto, to join us in reflecting on the election itself, and then we'll also have a comment from the inner city struggle. I'm having difficulty. Has Rosa joined us? Is she on the line with us?
It doesn't appear as though she's on the call yet.
Okay, all right then. Well then, I'll kind of step in a little bit myself, where we just really wanted to create a space, as we've done in prior times when a lot is happening in our community and lots happening, to create a little time and space for people to reflect on, you know, what the actions of the last week mean to you personally, and what they mean to our community. And so it's an open floor space for everyone to share kind of thoughts and reflections based upon this very, very confusing and complicated time that we're living through right now. Would anyone care to share some thoughts and feelings about the week that we are still very much actively in?
Well, I can jump in here.
Sorry.
I think that I'm getting some feedback, but yeah, so the news of the day is, or of this morning, is that we're gaining, the Senate is back in play basically, and the presidential election looks soon to be concluded with a selected candidate, which is good news generally for all of us. But I think that, you know, something that's important is that there were 70 million people who voted for the opposing candidate. And we need to learn about what it is that attracted them to that candidate, and what is it that they feel that they wanted, or that that person could deliver, that we need to address, that we need to learn more about. So I think it's an opportunity to challenge ourselves, to learn more about what our country is interested in and what it needs, and how we can work together better, and whether or not we really could be a United States.
Thank you, Ari. That was very well said. I think there's a lot of learning and listening that we want to do. Does someone else want to comment on some feelings and reflections about, you know, what I think? I agree with Ari that I feel like I'm still so much in the national races. I haven't paid as much attention to kind of what's happening at the state and local levels, but anyone care to comment on their own feelings and reflections?
Well, I'll just add that building on Ari's comments, that locally we have a 5-woman power board of supervisors now, with Holly Mitchell, who I know, as many of you probably saw, has a very strong agenda on children and families, and looks at communities holistically. She's very has quite a record on that ward, both as a person who worked in the community in the nonprofit world, as well as a legislator in policy and advocacy, you know, worker. Nationally, I've told a lot of my family and friends I have no more nails left. You know, been nail biting since I'm one of those political junkies that has been on it, as though, you know, I'm going to make a difference. And I've been ready to call it more than the networks have. But in any case, I think, as Ari said, you know, and also Heather, for me, what does this mean locally for us? because, you know, we mirror the nation. So the divisions across the nation, you know, kind of promise a lot of work for us to do locally as well, to see how we can contribute to more collective thinking and action.
Thank you so much, Teresa. Who else would like to share?
Hello. If I don't know if anyone else can speak, but yeah, I've been following the elections as well. I think we're just seeing a lot of division within the Democratic Party, right, between like progressives and moderates and stuff. And I think we need to have those conversations. I think those are conversations that have been avoided for a while. Yeah, just talking about the future of the party. The win was very marginal, right? And we need to see how we can like attract younger voters, try to like progress policies. We're already hearing from representatives that progressive policies are to blame for certain losses in the House. But that just the reality of it is that those policies are being supported in places like here in LA, you know, Minnesota, defund the police, Medicare for all, and stuff like that. And I don't think those should be sacrificed just to try to appeal to moderates or to conservatives. So yeah, it's a lot to think about. It's definitely a long conversation that's going to take place. It's not something that's going to happen overnight, right? And I think there definitely needs to be more unity in the party. So yeah, just seeing like what the solutions are and like just concrete communication is definitely going to be important. And moving forward, just seeing like changes in leadership possibly. Yeah, it's got a rough time, I think. But yeah, I think I'm hopeful, optimistic. But yeah, I think we're in a good place to start. Hopefully, like, you know, Biden can keep these leads. But yeah, it's definitely just like bittersweet all around. So yeah, just gonna keep following it and keep moving this work forward.
Thank you, Orlando. I think that word bittersweet kind of does resonate a lot in terms of, you know, a hopeful victory, but not one that is, you know, a decisive one. I guess it's decisive, but not overwhelming. Anyone else like to share some thoughts and reflections about where we are today and kind of looking to the future?
If no one else is adding, I just thought of something else that was interesting to me is how strong the Latino force came out to vote locally in our county and state and nationally, but also as everyone has mentioned so far about the work to do. I think as a Latino population with a strong vote power in moving forward, you know, I thought it was interesting to see divisions as strongly across the nation as well within our voter base. I'd like to learn more about that.
Thank you. Thank you. I think there is an interesting sense for, I think, many of us about, you know, are people really voting for their best interests? And if they aren't, how do we, you know, kind of help in the educational piece of that? Ruby has a question. Ruby, would you like to make a comment, or not really a question? Would you like to make a comment?
I do. I think, I mean, the election, there's a lot. I can echo what everyone shared when it comes to the national scale, but I think like locally, the election was also really surprising. How almost like some of the propositions that were on the ballot for a liberal state to take the type of stance that it took on, you know, on affirmative action, on union ability for workers to unionize, on, you know, all of these different what seem to be very like almost like progressive or like liberal propositions and measures, and for them to be this close or to not pass, it was very it was very telling of like the reality that we live in California and how truly divided the state is when it comes to like important issues at home. But the hope that I do have is the passage of Measure J, and the fact that such an important like grassroots effort of bringing upon like systemic change in the county was passed in the county, and that gives me hope because of everything that will come from the passage of Measure J.
Thank you, Ruby. Well, if anyone else has any reflections, please feel free to chime in now or add anything to the chat. But with that, we'll move on to, there's some opportunities in the action that are coming up. So I wanted to invite Orlando Martinez from Inner City Struggle to tell us a little bit about something that's happening tomorrow.
Hi, everyone. So tomorrow we will be having a mobilization towards Pershing Square. We're having a meetup at Mariachi Plaza. There's different meetup locations depending on different organizations, right? I think Coco's having like their own meetup and stuff, but for Boyle Heights, for the east side, it's going to be a meetup at Mariachi Plaza. This is going to be a mobilization opportunity. I think it's just a good opportunity for folks to voice their opinions, right? Especially on an election that's just been so stressful. I think it'd be a really good opportunity to just blow some steam. We want to use this as an opportunity to progress the policies that we support, right? Housing justice, educational justice, early care and education, just being able to voice support for that, show that there's progressive support for those things, show where Los Angeles stands on the issues. I think it'd be a really good opportunity. I'd like to invite everyone to come by. We're having a meetup. We're going to be trying to implement social distancing, wearing masks, right? We do want to stay safe in this pandemic. And yeah, I think it'd just be a very good opportunity to just build community and just show solidarity during these times. You know, we are feeling that it's hopeful. It's just a really good opportunity to just get out there and voice your opinions on the issues. So if you can, please come by. It's going to be a very good opportunity. We're going to have a lot of people there, and yeah, it should just be an opportunity to just voice opinions and build community. So yeah, if you can make it, we'd really appreciate it. You know, there's power in numbers, so if you can stop by, please do. And if you have any questions, please feel free to message me in the chat privately, or you can also email me. And I'll drop my email in the chat.
Hey, who's this? Orlando?
Yes.
Orlando. I just want to share that we've gotten some pushback apparently from the Democratic Party about not wanting to create a negative scene. So we need to make sure that that we have safety protocols and that there aren't any confrontations that will take away from what you just said was the intention.
Oh yeah, yeah, we are. Apparently, yeah, we are having social distancing. We're gonna have peacekeepers. We don't want to incite any like, you know, arguments. We don't want to get into confrontations with people who may be trying to provoke. That's not the intention at all. I'm not sure if you have any suggestions as to how to prevent that, but we will be having peacekeepers. We will be we will be abiding by police guidelines, right? They are saying that to stay on the sidewalks and stuff like that. So we have been in communication with them, and we will be keeping the peace. We do have people with roles specifically for that to de-escalate any conflict that may arise.
And this is Ruby. If I could jump in real quick. Thank you so much for presenting that, Orlando. I'm with Inner City Struggle. I'm also the lead on peacekeeping. I'm the liaison with the National Lawyers Guild and the liaison with the LAPD for the Mariachi Plaza March. So I can let you, it's going to be a peaceful demonstration. We're trying to celebrate the fact that we had so many folks come out to vote, and now we're just, you know, making sure that the votes are counted, right? And we're standing together across the nation to continue to defend, you know, the validity of votes, and the fact that we as citizens who have the privilege to vote and had the ability to vote by mail due to safety, that we're counted. And it's a national movement. There's going to be sister marches across the nation asking for the same. And it's going to be huge, but it's going to be it's definitely meant to be peaceful and celebratory in a way, because we came out, like we've shared, you know, especially as we saw like in the east side, we saw in our polling stations, we saw like how many folks came out to vote, and we just want to come out and celebrate that, and celebrate and advocate for their votes to be counted. But again, if you have any suggestions or recommendations for what safety could mean, feel free to reach out to me. I think I dropped my email in the chat, because I'm taking the lead on peacekeepers for the East Side March.
Hi,
So-
I just have one thing to say real quick, Ari. I would just make sure that you reiterate peaceful, celebrating votes also, because I think from the flyer and from what you're saying, it's kind of a little different. But with social media, just, you know, putting it out there as peaceful celebration of, you know, and making sure that people's votes are counted.
I'll definitely share that with the broader coalition, so that they can incorporate that into the messaging that goes out.
Yeah, so the other touch point I would make is with LAPD, because I feel my impression has been that some of these rallies, you know, especially like after the sports and all that, they've been trying to control the response versus then just guide the response. So, you know, let's collaborate, or let them know that there's going to be peacekeepers and that they should work in tandem with them, not come in with their mounted police and do what they do, you know?
No, so we've been so this protest has a coalition that's been organizing it with leaders from UTLA, different labor unions, different community organizations, and they've been in conversation with LAPD. So because there's a moratorium on permits, we don't have a permit for the demonstration, but we have the First Amendment right to demonstrate. So they're working with us. They're giving us like what guidelines we can follow to make sure that, like, you know, like they're in communication with us as peacekeepers from across the different march points, and all of that has been like thought of ahead of time, just to make sure, and even a plan for like what happens if there's counter protesters that show up, and what is the expectation for LAPD, and what is LAPD's expectation for us.
Thank you, everyone, for sharing about this opportunity to participate in a peaceful demonstration tomorrow. I did want to make a quick couple comments. Pamela recommends that everyone doesn't forget their poncho or raincoat, because it might rain on us tomorrow. And then Monica had a comment about something about participating by car. And so I was wondering, Ruby or Orlando, is there a car portion of the action tomorrow, or is it all on foot?
There will be a car caravan, and again, we're meeting at Mariachi Plaza, and there you can join us by car, and we're gonna have inner city struggle cars in the lead and behind, and peacekeepers that are also focused on guiding traffic. Once we meet up with the larger Pershing Square march, there will also be a car caravan route. So the cars will not be with marchers, but will be on a street parallel to the marchers, just for safety, to make sure that no marchers are harmed or nothing like that. So the march itself will be going down Hill Street, and I believe that the cars are going to be going down Broadway.
Great, thank you so much. Okay, everyone. With that, we will move on in our agenda. We've got some announcements and partner sharing. So first up, I'd like to invite Kaiser Solis's office. We have Elise Weinberg with us today, and she's going to be speaking with us a little bit about the Measure J and also some CARES Act updates, as well as anything else you'd like to share with us, Elise. Thank you so much for joining us today.
Thank you so much. I'm really excited to join you all. I can't believe this is my first time joining this meeting, so grateful for the opportunity to hear from all of you and answer any questions, and just, you know, see what all you are working on. So thank you. As was mentioned, my name is Elise, and I work with Guadalupe and other members of Supervisor Solis's team, and just want to talk to you about two matters, but happy to answer any questions related to the COVID-19 response as well. The first is, as the slide says, the CARES Act. So as I think you all know, the CARES Act was a federal piece of legislation that resulted in funding to states and counties. LA County, given its size, received a good amount. However, of course, we are still advocating for more funding because, as you all know, the need is there. But the purpose of the CARES Act was really to address issues related to COVID-19, of which there are many, which I will talk about. We are still in the process of distributing that funding, as many of you may know. I think in the next couple of weeks, we will have really most of the money distributed out, and that money does need to be spent by December 30th of this year, not December 31st, a weird quirk in the law. But really it's, you know, the good thing about this funding is that it's flexible in a sense that the county was really able to use it to address the needs that we're seeing on the ground with respect to the health crisis. And so a lot of it is going to addressing the health crisis head on. And addressing many of the disparities that we've seen, unfortunately, many of the disparities that have been most profound in the first district. Specifically, I was asked to talk about one particular significant source of or allocation of funding rather through the CARES Act, which many of you, I hope to in the next coming weeks be able to share more information about it. But Supervisor Solis, like she does in all her work with community, her through line is really equity. And so much of this pandemic, like I said, has disproportionately impacted communities in the first district. And unfortunately, you know, like the information just isn't getting out in a way that people can really digest and understand. You know, we're seeing that we have lots of COVID-19 testing sites in the first district. Unfortunately, though, there is a significant unused capacity. It was pretty booked once, you know, when we had a significant number of cases, but unfortunately we are still seeing the need to really reach out to certain communities and make sure they know what resources, including testing, have an understanding of contact tracing, and have access to healthcare. So having said all that, one of the ways Supervisor Solis really challenged the county to take that on was by allocating $30 million to community health workers or promotoras as part of the COVID-19 response. So two county departments are actually going to be benefiting from this allocation of funding. Like I said, it does have to be spent down as of right now by December 30th, but given, you know, that we know how successful community health workers are, we're hopeful that we're going to be able to really support a program like this long term. The two departments are the Department of Public Health and the Department of Mental Health. The Department of Public Health is getting a significant portion of the funding. And there's really two aspects of the program that they're creating. The first is that they've actually already started hiring several community health workers as DPH employees. This is a really exciting part of the program, and I think DPH has done a really incredible job being creative on this, because what they're doing is they're training community health workers to be inspectors, so to speak, and where they're going into businesses and helping businesses come into compliance. And that's good for a couple of reasons. First, it just builds our capacity to really ensure that community is complying with the health officer order and COVID-19 guidelines, but it's also building a workforce pipeline. For a lot of these people, they're being trained for the very first time to really learn how to take on this work. And so DPH is really hopeful that this is going to create a pathway for them to really take on this work, you know, even after the funding expires. And we're really hopeful that we're going to be able to identify long-term funding for that. And again, that's still being worked out. This is all happening super fast. The second source of funding is that, or rather the second part of the program is the Department of Public Health is contracting with several community-based organizations, agencies that are already doing this work, some agencies that have expertise, for example, on gang intervention, or really deep connections with community to become community health workers or promotoras. And so that, I think in the next couple of weeks, DPH is going to announce, but it will result in hundreds of new promotoras in the 1st District and hundreds more in all of LA County. This is really to, although this is a county-wide program, these workers are really going to be dedicated to areas that have been underserved, where we have high case rates and high death rates, which again, unfortunately, are many of the communities you all work with in the 1st District. So that is the DPH piece of it. And then thirdly, just quickly, the Department of Mental Health is also getting some of the funding for this. Many of you may be familiar that the Department of Mental Health already has a promotoras program, and through this, they're going to be able to train those workers on more of the mental health related issues that have stemmed from this health crisis, of which there are many, as you all know. People are really hurting when it comes to mental health. And so our goal is really to make sure the community health workers that are employed or contracted by the Department of Mental Health have the education, the tools they need to get community the support. So that's a little bit about that. We're really excited. This took, although it may be a no-brainer for some of us that this is a program that needs support, there are lots of counties that are already, that use their CARES Act funding for this, or have had community health workers as part of the COVID-19 response from the very beginning. Even Orange County, our neighboring county, for example, had some community health workers that were really addressing the disparities. And so we're hopeful that we're going to really be able to close some of those gaps that we're seeing. And so more to come on that, and happy to join you again as we get more data. I think some of your organizations will be more up to date than I am, probably, because you'll all be intimately involved. The second related issue that I want to talk about, just because it is funded by the CARES Act, is on matters of food insecurity. Before the pandemic, the county's role with addressing food insecurity was pretty limited. In a sense, Supervisor Solis has always worked on, with her own discretionary funding to address food insecurity through providing grants to organizations, or through her Thanksgiving turkey giveaways that she partners on with many of you. However, the county as a whole really only addressed food insecurity through CalFresh, or food stamps. That has changed drastically since really, I want to say March or April even. We've now been hosting 3 food distributions on a weekly basis, serving thousands of households at each of those distributions. So we're partnering with the LA Regional Food Bank on that. We, through the CARES Act, the supervisor got the county to commit millions of dollars to different ways to address food insecurity, including through grocery vouchers. So this is a program that's going to be announced next week, where people, in addition to being able to access food boxes at the food distributions that the county hosts, or through some of the community-based organizations the county supports, some communities are going to benefit from grocery vouchers, because we really want to make sure they have that dignity and being able to choose the food they want. That's really important. So more to come on that in the coming week. Additionally, and this will be announced in 2 weeks, but we're moving forward with the grant program. So lots of community-based organizations that are serving community applied for grants to be able to continue providing food in community, many of which are in the 1st District. So once we have the list of grantees who were awarded this funding, we will certainly share it with the group, and more details on the grocery voucher program. But again, I think the supervisor is really clear that, some of what the county has started to do in addressing food insecurity during the pandemic needs to continue well past the health crisis. The food distributions, for example, she often asks, why weren't we doing these previously? The lines are long now, and they were likely long prior. So I do think that, this is going to continue to be one of the ways the county addresses food insecurity moving forward. And then lastly, Measure J, which many of you, I think, are very familiar with. The voters, I think it's safe to say, approved Measure J this last election a couple days ago. And what it's doing is really investing in community. So beginning next year, 10% of locally generated funding is going to be utilized for community investments. So we are carving out county locally generated funding to build housing, to support youth, the workforce, and really all programs that our communities invest in. There's a board motion on the agenda Tuesday to form an advisory committee to really dictate how that funding is going to be spent. It's going to take a lot of community engagement, and I think we'll have more details on that in the coming weeks as well. But clearly the voters have made clear that Care First, Jail Last is their vision, and they they really expect their Board of Supervisors to achieve that. And so we'll be implementing Measure J at their direction. And that's it from me. I'm happy to take questions or come back and share information if you all would like updates on any of these or more.
Thank you so much, Elise. Do we have any questions for Elise on any of these initiatives she shared with us or other things that are happening in Supervisor Solis's office or at the board level? I have a question in the chat for you, Elise. It says, how can we learn more about the Workforce Advisory?
Sure. So I think this might be related. Is this related to Measure J? I'm happy to send the board motion that creates this advisory committee, so you could get a sense of what who will be part of this advisory committee. It will include community, and it will include a lot of the county departments that are really providing social services to folks. So I'm happy to share that board motion so you could get a sense of the structure that we're looking to build, and talk to you and connect you with the departments that will be leading this. It's the two departments that are really, it's going to be a county-wide effort, but the two departments that are really tackling it are the Alternatives to Incarceration, which is a new office out of the Chief Executive Office, as well as our Office of Anti-Racism. So those directors, along with the Department of Health Services, the Department of Workforce Development, and others, are really going to be leading this effort with community. So I'm happy to share more information, including, I see Monica, your question in the chat, can we get involved in meetings? Absolutely. The voters were very clear that they want 10% to be carved out for these purposes. But that leaves a lot of room to really determine exactly what the programs look like. So absolutely, I think this forum is going to be really key to dictating what how Measure J is allocated. And I would be remiss not to add that restorative care villages was called out in Measure J. So in addition to housing and rental vouchers, the 10% can be allocated in part to helping support shovel-ready restorative care villages. So hopefully that results in a lot of housing and support for community. But in short, happy to share information about the meetings and all else, so you all can be involved with that.
Perfect. We do have one other question from Pam. Has there been accommodation or consideration for the opportunities for undocumented workers or for undocumented individuals to participate in the Promotora program?
Yes, absolutely. That is key. This is really, this program is for community by community, and I truly think that's some of what's been lacking in the county's COVID-19 response. So absolutely, that's the community that the supervisor intends to serve in part, and that means that the community health workers that are brought on need to reflect that. So yes.
Any final questions for Elise? All right, with that, we will move on. We have many other items on the agenda today, but thank you so much for your time, Elise, and for the great updates. It's
Thank you.
very hopeful time to see so much progressive action taking place in the county.
Well said. Yes, thank you all so much.
With that, I'm going to invite colleagues Ismael Castro and Dalila Lopez from Building Healthy Communities to give us a little bit of news about a new police reform conversation that's happening in our community right now. Ismael and Dalila.
Hi everyone, good morning. Ismael Castro with Building Healthy Communities here. I'm gonna turn off my camera for internet stability, but this is me. So yeah, like Heather said, I'm here to take an opportunity to discuss police reform. And this is part of a study conducted by UC Davis's Center for Healthcare Policy and Research, and is done in partnership with us, Building Healthy Communities. Next slide. So this opportunity comes to us from two things that we know are happening for sure, right? We know that at a local level, spending on policing has increased as portion of city spending over the past 16 years, even when both violent and property crime rates have stayed historically low. Another thing that we know is that nationwide there is unrest about police brutality because individuals who are disproportionately Black and Latino men and trans women of color are dying at the hands of police officers across the country. And so the question at hand is whether the current policing models are effective and whether they are currently making good use of the funds. And so what we hope to explore through this opportunity is if there are new models that might make more sense. Next slide. And so the opportunity is to participate in discussions on options for police reform to potentially change the values, the culture, policies, and practices of police organizations in Boyle Heights. And the sessions are structured in 2-hour sessions with about 10 to 12 people, where we will first review several options for police reforms that will be presented by facilitators. That's going to be followed by a discussion with community members and stakeholders. And from that discussion, we're hoping to inform policy recommendations that could potentially shift policing cultures in the next like 1 to 3 years. Next slide, Heather. And so these upcoming sessions are Tuesday, November 17th, Wednesday, December 9th, Tuesday, December 15th, all from 3:30 to 5:30. I will be sharing a doodle poll in a bit so that folks who are interested can start just seeing where their schedules fit. But there are some criteria. So all participants must be at least 18 years old. They must be community members from Boyle Heights. And so not necessarily residents from Boyle Heights, but folks who work in Boyle Heights, folks who are invested members of the community, And the sessions will be in Spanish and in English. And so members must speak Spanish or English. We know that there's a more diverse culture, but for now, we're only doing sessions in Spanish. Sorry about the helicopter, if you can hear it. And participants must have access to Zoom. So this could be having access to technology and internet access. Next slide. And so, yeah, this is a great opportunity that we're really excited about. I'll share the doodle poll in a bit. We'll have separate sessions. I am coordinating community sessions. And so this is any community organizers or leaders from community organizations or nonprofit organizations. And so this is my email. You can reach out to me if you're interested, in addition to filling out the doodle poll so that we can start seeing how folks fit into these different sessions and how much space and availability we have to secure folks. So now I'll pass it over to Dalila, who is going to be coordinating a different session.
I'll be coordinating the session that's more for providers and for people who work with the Department of Public Health or any other county agencies that work closely with the community of Boyle Heights. So if you're interested in this, please send me an email to dalila@thewellnesscenterla.org. I'll be sending out more information, and I'll also be reaching out to people that we've worked with recently and in the past that will qualify for this session. That's it. And thank you, Anna, for putting my email in the chat for everybody to see.
Yeah, thank you. So I just shared it. Thank you, Dalila. So I'll pause in a bit for questions, but I just shared a doodle poll on the chat. And again, this is only for members who work with community, either as community organizers or who are community residents, but not working at an institutional level. So if you're interested, please fill out this doodle poll and send me an email at ismael@boyleheightsbhc.org. So now I don't know if there's time for questions, Heather.
I think we have 1 minute for questions. If there's any high level questions, if you have, but I do recommend if you do have questions, if you have interest, please be Ismael, please be in touch with Dalila. They can explain the opportunity to you more fully. We're excited that this work came to us as part of our California Accountable Communities for Health initiative, and we were able to partner with the Building Healthy Communities program to host this community conversation and to be part of a statewide conversation about police. So we are one of multiple communities that are selected for this opportunity, and we're excited to be able to bring the voices of our residents, as well as the people who work in the community and the people who work on the LAC USC Medical Center campus in this conversation. With that,
Wait, there's a question. Priscilla would like to know if the poll can be shared.
Hi, so yeah, for this community session, please feel free to share, but let them know that in addition to filling out the doodle poll, they also have to send us an email letting us know that they're interested. They both work together or else we won't be able to contact them. Thank you.
and of course, as we mentioned, these are small size groups, so there is going to be kind of limited ability or opportunity for participation, but we want to get as many people that are really passionate about this subject in the conversation, because we want a really diverse and rich cohort to join us in this work. All right, with that, speaking about our campus and things that are happening locally, I'm going to invite our fantastic CEO of our hospital, Jorge Orozco, to share with us some updates from the campus in the time of COVID.
LAC USC in the time of COVID. Can you all hear me? Yeah, good. Interesting times. We are in the midst of a spike nationwide of COVID. Yet we have not seen that spike happen in the hospital here, which is interesting. I know the cases in LA County continue to climb. So we're just waiting for the shoe to drop. Not sure why we're not seeing a significant increase in our COVID numbers. We have 34 inpatients in our hospital right now. 16 of them are in ICU. So people are still getting significantly sick with COVID. In terms of the hospital is ready. Though we are busy with just normal stuff. Our emergency room is seeing between 300 to 500 visits a day. Our inpatient census is high. And we're trying to catch up on all of the surgeries and procedures that were put off because of COVID. And so there's a lot of work happening in the hospital to ensure that our services are accessible and available. As many of you know, we've also pivoted how we're doing things. We have a drive-through walk-up testing site that tests all patients before their procedures or before their surgeries here on State Street. And we're also administering vaccinations in a drive-through format. So that's been an exciting development for us, as well as the use of telemedicine and telephone visits for our patients. We've certainly learned a lot in the last few months that we can deliver appropriate quality care through the telephone, not in all cases, but in many of the cases. And so that certainly is going to be part of how we deliver care into the future. Yeah, so that's what's going on in the hospital. Any questions? All right.
Does anyone have any questions for Jorge at this time? It's great.
It's Monica. I just wanted to say that I'm really glad that the numbers are a lot lower than they were in previous months, and let's just hope that maybe the residents are doing better as far as protecting themselves, and we won't necessarily see that spike, even though it's nationwide, it's higher.
Hopefully not.
So it's great to hear that you're able to catch up on the backlog of some of the surgeries and other services that people need. So that's wonderful news. Are you concerned about a potential new spike as the weather does get colder? Obviously, we lag behind the rest of the country in terms of our weather concerns.
Yeah, we see in other parts of the country that, you know, hospitalizations have spiked. So we are a little bit worried about that. You know, our hospital system in Southern California doesn't have a lot of room to grow. And largely it's not space, it's personnel. It's having the appropriate doctors, the appropriate nurses to take care of patients with COVID. So it's always a concern. You know, at the height of this, we were up to 140 patients with probably about 60 in the ICU. So we have a little room to grow, but not a lot.
Is there a concerted effort at this time to make sure that we're promoting, during the holiday season, people like to get together with their families, which is one of the opportunities for spreading. Is there, you know, is there consideration around doing a big public information campaign to help, you know, keep people realistic about what's safe to do with families?
So yeah, anytime we have an opportunity to interface with the media and in our social media pages, you know, we always send a message, you know, take care of the 3 things you need to take care of: wash your hands, wear a mask, and keep away from people. And those things work. I mean, those are very simple things, but they work. And yes, over the holidays, I mean, we've seen spikes during Labor Day or after Labor Day, you know, 4th of July, and you see spikes happening. So yeah, we are concerned about Thanksgiving and Christmas holidays. So wear your mask, stay away, have your gatherings be very small. So.
Thank you, Jorge. Any final, we have some comments just thanking you for the work, Jorge, for you and your team. I hope this means some of your team members are getting some well-deserved rest and or breaks and vacation days. I mean, you guys were full throttle for so long there. I hope this is giving everyone a chance to take a deep breath.
Yeah, thank you.
Yeah, so I have a quick question, Jorge. This is Ari. So I keep reading about how the statistics are that Latinos are the highest percentage in LA County, and above that, Latina are higher, the highest percentage in LA County. And I keep thinking about a comment that you made where you said, oh, we're able to send people home with their own oxygen tanks so that they don't have to be in the hospital, yeah, and they can take care of themselves at home, which is great. However, my question is, along with that oxygen tank, are they also sending PPE and education to the caretakers? Because it seems to me that that's how that high infection rate among women is happening.
Yeah, great point. You know, the patients that are sent home with oxygen are functionally independent. You know, they walk on their own. They're able to move around. They're not bed bound. They're not that sick, though they're having trouble breathing. So we certainly send them with education. PPE is not something we send them with. You know, they are told to self-isolate and follow the protocol. And we call them every single day. We ask them what their oxygen blood oxygen level is, and we monitor them. If they need to come back into the hospital, we bring them back. But the outcomes that we've had from that program have been tremendous.
But shouldn't we be providing the N95 masks and that level of security to the people with whom they live and to those individuals?
I mean, that's a good point. I don't think we have enough N95 masks to be distributing to the circle around, and it's something that we should absolutely look at. So I will follow up with our program coordinator of the oxygenation program to see if that's part of their screening protocol. I just don't know if that is. I haven't heard that that's what we're doing, but we might be.
Jorge, at a previous meeting, there was a question about specialty care and how we're doing in getting people to the right appointments, given that, you know, a lot of people have delayed their appointments. Can you speak specifically about specialty care?
Yeah, the majority of the backlog is specialty care. Our primary care services have been fully operational throughout this pandemic. And so we're able to monitor patients, and if they need specialty care, we refer them to specialty care. We do have backlogs in certain specialties: ophthalmology, I think neurology, cardiology, and we're looking to contract. If we're not able to provide those services here, we're looking to contract with other providers out in the community so that we can pay for their care to go to HICP or to go to White Memorial. And so we're actively working on those contracts so that we can do that.
All right. Barring any additional questions, Jorge, I think we will thank you and thank everyone at the hospital for all that you do for us in the community. And we'll move on to the rest of our presenters today. Thanks so much. Next up, we have the lovely and talented Rosa Soto, who's going to give us a quick update on the Third and Dangler Project Committee.
Hi, everyone, and sorry about my technical difficulties earlier. But I wanted to talk for a second about Third and Dangler. I don't know if Guadalupe is on the line and would like to share any thoughts she's got about this, but you all might remember a couple months ago, we agreed as a Health Innovation Community Partnership to support the Third and Dangler Affordable Housing Project with their community benefits planning and organizing. So today, we've got 3 committees that are active, and actually they have meetings today on Friday. So the first is the Pocket Park Committee. They have had now 2 meetings, and their meeting is at 11 o'clock right after this meeting. Then there's a Public Art Committee that is working on the public art on the facade of the front building facing the street. And then the third committee is the Advisory Committee, the overall Advisory and Oversight Committee that will be reporting at this meeting quarterly. So if you're interested in attending any of those meetings, please, we're going to put the times in the chat so everybody can see those as well. If you signed up previously for the committee, you should have already received an invitation, and we will do everything in our power to make sure that you have the materials that you need for these committees and for the work that needs to get done for Third and Dangler to be a successful community benefit project. So are there any questions regarding that project? Hearing none, we're continuing to move forward. So again, we'll put the times on the chat, and please reach out if you've got a question about the committees and whether you're part of one of the committees or another. Back to you, Heather.
Great, thank you, Rosa. With that, I will invite Alicia Ramos to come and share with us some updates from the campus projects that are happening on our LAC USC Medical Center campus.
Good morning. Thank you, Heather. So we'll start with the projects we've got on campus. If you could go to the next slide. Thank you, Heather. Update on Women's and Children's Hospital demolition. So the last time we joined HICP, we let everybody know that we had hit a bit of a hiccup with our plan for awarding the contract for the demolition. Our initial proposer withdrew, and we underwent negotiations with the second proposer, which turned out very successful. And we are on track to award that contract at the end of this year, December. So things are moving forward with that, and we'll continue to keep you updated. Next slide, Heather. Restorative Care Village is the other project that we have quite a presence on site, and this is right next door to where Women's and Children's Hospital is. So what I've included here is really just some images of what's going on. We still have quite a bit of work going on in the ground. So what you're seeing are some images of the utility lines, infrastructure going in, and then the beginnings of the foundations. Next slide, Heather. Again, some more pictures of what you may be seeing on site. So as you're walking around the campus or have occasion to visit the campus, this is similar to what you might be seeing happening. Next slide, Heather. Child Care Center is our other project that is ongoing right now. So we are still within design plan check. We expect to be done with plan check in the coming month. So closing out this year, we should be done with the design process. We did have an opportunity to meet with the operators that will be basically staffing and be responsible for the operation of the Child Care Center. We had a chance to go through the updated design with them, and I think they were very pleased with what they saw. Next slide, Heather. And this is exciting. The Courtyard Refurbishment and Elevator Addition project is currently out to bid right now. And just to give you a reminder of what that is, it's occurring very centrally in where the new hospital location is. This project will take place between what we know as the outpatient building, which is to the north of the courtyard, and the new hospital. If you're familiar with that area of the campus, there are stairs and sort of a spiral ramp that connect the two levels. And this project will be basically installing 2 new elevator cabs so that we've got a more efficient vertical transportation and makes the area much more accessible for pedestrians, folks with strollers, folks who may have disabilities and mobility issues. So we're very excited, and we expect those bids to come in at the end of this year. We anticipate the bid opening to be December 8th. And again, we'll keep you updated on that progress. Thank you very much, Heather.
Thanks, Alicia. So what's the timeline on the elevator project? Do you have a sense of when it might be actually ready to, push the button and go?
That's a great way to say it. Elevator project we anticipate will be about a year. So it's not going to be something around the corner. It is something that will take a little bit of time, especially with the coordination we'll have to do with the campus. It is a very key area of the campus. So there's a lot of areas there that we'll want to be very careful about, make sure that we still have an accessible route for folks to access their care. But yeah, about a year, Heather.
Okay, great. Thank you so much, Alicia. Yeah, we're very excited about increasing the accessibility of the campus to all of our visitors. So that's a wonderful addition in addition to, of course, the Restorative Care Village, the Child Care Center. It's just a lot of wonderful happenings. None of this work you do is quick, Alicia. We do understand. So thank you so much for coming back and giving us the updates so that we know where things stand and what our next steps are. Any questions for Alicia on any of the projects that we've just shared?
Yes, I have a question. This is Ari. Alicia, thanks a lot for that update. As noted, there are multiple projects. I think you're now up to 4. I was not aware of this additional courtyard project previously, but My question is around the local hiring. And I know that we kind of made a formal agreement for the hospital demolition and all that stuff. Where are we on making sure that local hire is a goal and a priority with the other projects? And along with that, you know, I see notifications of other projects happening throughout the county, and I see within their press releases all about local hiring. So it's not something that's new or challenging. You know, I mean, other supervisorial districts are accomplishing it. So really my concern is around, number one, are we actually implementing it? Number two, are we succeeding? And three, are we promoting its success? Because we want this not only to happen for these projects, but also to be a model for other projects in the area and beyond.
Yeah, so all good points, sorry. Elevator project, courtyard refurbishment elevator project will also be one of those projects that we'll be monitoring for the local targeted hire participation. So I know that you've been participating in some of our other meetings that are focused on the workforce. And so we will be putting this also on that monitoring to update everybody as to how we're doing. Elevator courtyard is at the threshold where we will be looking at that type of participation, local worker and target. So just as we've done in the past with RCV and women's and children's, we'll be reporting those numbers on a monthly basis. And I think we all have that emphasis that we want to see these numbers hit, not just our thresholds that are required, but those aspirational goals too. So I expect to see that this project will be on those lists. We're obviously at the start of this, so we don't have those onboarding numbers yet until we have a contractor on board. But we'll be also addressing this project as well as the others with what we've been calling the jobs developer component or consultant. And that's an effort for all of these campus projects to kind of speak at a larger picture on the larger scale to say, if we're not meeting these numbers, why? What are the things we can do to make that networking happen more effectively? And, you know, to carry this past even these projects, we've been calling it sort of a living pipeline to start that, that robust structure of keeping this not just focused on these projects that we have at hand, but to keep it going in the future too. So we'll be giving updates to both of those efforts, to the projects, to the monthly numbers that we're hitting, and then to what efforts we think could enhance what we're getting.
Thank you, Alicia. So next up, we're pivoting from our campus projects and campus updates to talk a little bit more about how COVID is impacting our community. We have invited Martha Gonzalez from Clínico Romero to share some of her thoughts on how the COVID pandemic is impacting her and other community residents. I believe Martha will be sharing her comments in Spanish. So if you'd like to get the simultaneous translation, please go down to the toolbar on the bottom of your screen and select the interpretation button for English. With that, I invite Martha to share her comments.
Muy buenos días a todos. Gracias por la invitación. Clínica Romero está haciendo community tests en la comunidad Highland Park, Pico Union, Boyle Heights. La semana pasada nos invitaron a hacer exámenes de COVID en Palmdale, California, donde es una comunidad que casi no tiene estos servicios. Aproximadamente en lo que comenzó el COVID, hemos tenido 4,876 exámenes. Afortunadamente, en los community events afuera que hemos hecho para la comunidad, hemos tenido 0 positivos. Pero, ¿qué se escucha de estas personas? Una, se escucha de que cuando una persona o un familiar se enferma, lo tienen que aislar. ¿Qué pasa si esa persona tiene más familia en la casa y solo tienen un baño? Aparte de la infección que tienen el estrés de cómo estar lavando todo y estar limpiando lo del baño para no contaminarse a otras personas. Que también se escucha que qué pasa después de que esta persona ya salió del COVID. Las preguntas que se hacen es, ¿me va a volver a atacar? Mi familia ya está salva de que ya no contenga el COVID. Son preguntas que la comunidad se hace. ¿Qué es lo que pide la comunidad? La comunidad pide que se les dé seguimiento más profundamente a las personas que tienen COVID, porque sabemos que los hospitales están llenos y cuando tienen los síntomas comunes que te dice el doctor, quédate en casa, no salgas, ellos tienen miedo de que pase algo más y que no los puedan atender. También se preocupan cuando una persona, un familiar tiene COVID y se agrava, van al hospital, pero no lo pueden ver porque tienen por todas estas restricciones. También todo eso causa mucho estrés. Y más estrés cuando la persona recibe noticias que su familiar se agrava. Nosotros como Clínica Romero tratamos de dar información, cómo prevenirse, cómo cuidarse, pero ya cuando salen preguntas así, sí de verdad es preocupante para toda esta comunidad latina que en realidad lo que quiere son respuestas y que yo pienso que sería muy bueno, así como damos a lugares o localidades de donde irse a tomar el examen, ¿por qué no dar centros de apoyo sobre personas que ya pasaron por el COVID o por personas que están preocupadas por el COVID, por el estrés? ¿Por qué no dar un lugar de apoyo, lugares para personas que ya tuvieron COVID, que lo que sigue, que no entren en pánico, o personas que están preocupadas que se les va a llegar? Ahora con lo que estamos viviendo con el flu, que se escuchan en las noticias, en vez de tranquilizar a la comunidad, pues se alarma más porque se dice que ahora con el invierno se va a venir otra racha más fuerte de COVID. Entonces toda esa gente está más temerosa, que dicen, pensábamos que se estaba calmando, pero ahora que llega el invierno va a ser un poco más peor. Entonces debemos de salir a la comunidad y tratarlos de calmar, pero ¿cómo? Como les digo, ayudándolos con agencias que den apoyo y que den información de dónde ir si se sienten estresadas, si su familia ya pasó por el COVID, qué es lo que va a pasar. Ese es mi comentario. Gracias. ¿Preguntas?
Are there any questions, follow-on questions for Martha?
Just a quick question from me. I wonder if Jorge is still on the line. I saw his very comprehensive response to the earlier question on the chat, and it just made me, there's some correlations to his response to what Marta just shared, which I think is so great about what we're learning when we're on the ground with this living and experiencing this day to day with our families. And so I don't know if Jorge, you could, like, to the continuity of care, like that is given to patients. You touched on it, but I'm wondering if there's some more you can add to what Marta just shared.
I am not certain if Jorge is still with us. Let me double check. It looks like unfortunately.
Hi.
Here you are. Yay.
Yeah, you know, it's a challenge. It's a challenge to provide that continuity through a medical system. And that's why we depend on linkages with community organizations that you know, are embedded within the community. You know, I think we should think about, I mean, we have our social services departments who are very engaged with family members and helping them through the stresses of COVID. But the impact of this is long-term on family and community. And so how do we find ways to engage outside of the sphere of medical care with these families to support them? And I'm certainly open to ideas and suggestions for that.
Yeah, well, I think just to quickly respond and for me and let others chime in, because I think this is so important and ties into the this thread of mental health and what that means together with health care and social supports and other services at the community. But Jorge, so you mentioned that at the point of, you know, people are discharged or told to go home with these guidelines to self-care. I think that's such an opportunity to really, you know, ensure some connections to these kinds of supports that Marta mentioned, and perhaps others have other ideas of what other supports. Thank you.
Yeah, thank you again, Marta, for sharing with us. And I think it's an excellent segue, both through the commentary provided by Teresa and Jorge, into our next presentation, which is really around, you know, the health and healing that's provided on the LAC-USC Medical Center campus, and then the complementary services that can be provided by our Department of Mental Health as we have those emotional and mental needs as we experience both stress related to the pandemic, stress related to, you know, the many impacts of the pandemic, both health and economic and social and family oriented. And then of course there's the election as well, and there's stressors around that. I reference back to a comment Cecilia made at the start of the meeting where she mentioned that she's in her conversations and wellness checks with our clients, she's hearing from them, people are feeling a lot of anxiety, a lot of challenge because of the stress of the election. And so there's just been a lot going on for all of us. And so we're incredibly excited to have some guests from the Department of Health here to talk with us about some of the observations about what's happening in the community, as well as some of the services and resources that are available for that mental health and mental health self-care. So any further comments on Marta's presentation? Leticia.
Yes.
As follow-up, I'm just wondering, as an opportunity, as Teresa was mentioning, could like, for example, information when people come up to testing, right, and they go through those lines, might there be something that could be given at that time? We get, and I say that because I myself went to get tested, so it's very anxiety provoking, as you mentioned. So I could only imagine for the entire community, but at those moments when they're already coming into the healthcare system via the testing mechanism, as Marta was saying, could we give them some kind of information flyer or something where they can go get some questions answered? That would be a way of beginning to bridge that support at that very time and place. Just a thought.
I think that's a great idea. You know, when you go to the theme park and you're standing in line that long, that's a perfect opportunity to do the marketing to the people standing in line. So I think through the testing contact information, there's an opportunity to text to people and to provide resources to them and also to educate. But my other question was actually for Marta. Marta, la gente con que ustedes platican, ¿tienen acceso al internet o de dónde consiguen su información además de las noticias?
Gracias, Ari. Pues en esta época todo el mundo tiene un celular, consiguen información de ahí, pero lo que está diciendo Leticia, nosotros les damos un paquete de cómo usar la máscara, cómo lavarse las manos, cómo saber los síntomas. Todo eso se le da a la persona cuando viene a hacerse la prueba. Y referente a lo de Ari, sí, la gente a veces se pone en internet a buscar, pero lo que hemos escuchado es que en vez de ayudar, muchas veces entran en más pánico. Porque confunden mucho los síntomas con una gripe, con un flu. Entonces, cuando sienten, como dice, dolor de garganta, estornudos, dicen, ya me dio el COVID, y es cuando entran en pánico. Entonces, muchas veces sí ayuda la tecnología, pero también en otras maneras mortifica más a las personas.
So a suggestion I have, and I don't know if that would have to come from county or mental health or where, but something that we did in the LGBT community was do an education program to the media, because what they know is what they announce, and when they don't know enough or they know the wrong thing, they can disseminate bad information and panic people as well. But a lot of the questions that they're asking, nobody knows the answer to.
Heather, you are on mute.
Yes, I am. Thank you for pointing that out. I was actually going to ask you to help me by reading some of the comments from the chat that are in Spanish, please.
Now I am on mute.
Correct.
So one of the comments that Juana made was that all forms of resources, like just referring to they're being available, just at this moment in time, it's so chaotic, not just with the health, but economically as well. And then Priscilla is offering to Marta to share these resources or events that Clinica might be having that we can share through our social media and our networks, since we know that a lot of people still don't have access to the internet or to a smartphone. So she is offering to help, and she's offering all of us to help if possible.
Great, thank you so much. Yes, I think.
And then one other comment that Marta did say that as soon as she has a date for the next event, she will let us know.
Wonderful. Yeah, thank you so much, everyone, for engaging in this very important community conversation. We started the morning talking about some of the resources that are coming online through Supervisor Solis's office and through our county agencies. We've talked about the health campus and how it's doing right now. And now we're moving into this piece of the mental health piece of the equation. But I think we can see that across that spectrum, there is incredible need in the community and there are resources available. But now the challenge is always connecting people, building the education campaign and connecting people to those resources. So I'm excited that the community health worker program that Elise shared with us earlier is an opportunity to get some of this messaging out to people. And I think we do want that wraparound service and care model. So wonderful sharing, wonderful ideas, everyone. We thank you so much for participating so fluently. With that, I'm going to pivot to our next presentation. We are delighted to have with us today Dr. Jorge Partida del Toro, the Chief of Psychology for the Los Angeles County Department of Mental Health. And he's joined by his colleague and our friend and co-worker on the CASHI work group, Lara. Just as a refresher, I wanted to make mention that Leticia is one of the major leaders and participants on our CASHI work group, where we're focusing on the issue of trauma in families with 0 to 5. And this is part of the Health Innovation Community Partnership umbrella. As we know, we've been tasked by Supervisor Solis to help develop the Healthy Village model in the East Side communities around the LAC USC campus. And to that end, our CASHI working group has been working diligently over the last couple months to identify how we can raise the quality of life and the opportunities for children 0 to 5 that live in our communities. We have a fantastic group of committed members of our working group who have dedicated a lot of time over the last couple of months to come up with an action plan for 2021 and the years beyond that will help us really dig in on serving that particular population of children 0 to 5 and their families. And we're excited to be able to present more of that to you in the coming months. In particular, in January, we will do a more comprehensive presentation about the outcomes of the working group and where that action will be taking us in the year ahead. But with that, I want to turn the podium over to Dr. Partida and Leticia to talk with us a little bit about how to take care of ourselves and what's available to us in this very challenging emotional time.
Thank you very much, Ms. Heather Hayes. I appreciate you passing over the baton. And I know Dr. Partida is with us and he's going to come on shortly. We're going to kick it off. The idea in the next 20 minutes or so with you all is to have a little bit of a reflection. I was asked to give a little segment. I've been intimately involved over the last several weeks with your group on trying to bring forth information, but sharing ideas. I think the whole CASHI group and many of you have talked about how do you strengthen the community, how do you foster relationships, how do you access resources. And in the next few minutes, what I was asked to speak a little bit about is a little bit about mental health. What does it look like? So we're going to run through a bit of conversation, and then Dr. Partida will also come on board towards the end to be able to share a little bit about his personal experience as a leader in the department, and then give a little bit of a bigger picture as to what we're doing at mental health and some of the opportunities to collaborate and some of the work that we think is also responsive to community. So I know he's here with us, right, Dr. Partida?
Yes, I'm here.
But there you are. So that's Dr. Partida. So we'll do that a little bit. And for the purposes of time, we'll get started if that's okay with you all, okay? So if we can change to the next slide, Heather, I think when we talk about mental health and all of you, I know there's a diverse group here, leaders, you running medical programs, we have parents, we have leaders, all of us come to this work as caretakers, advocates. We've been in the profession trying to make a difference. And the mental health theme has come up throughout this conversation. We also know there's a lot of stigma with mental health, right? Yet we're all working to address mental health conditions. Marta talked a little bit about the COVID interface. In the CASHI group, we've been talking about young children and their well-being. And also there's a big myth sometimes as helping professionals, we ourselves, where's our mental health in all this, right? And I think that the few minutes that we have together is really a reminder, creating a bit of space to have a reflection on that. And I'm very well aware that I speak a little fast. So I'm gonna try to slow down because I know we have an interpreter working with us today too. The fact is we all have mental health and we often, because we're so busy taking care of others, we don't always manage our own emotional well-being. And that's the purpose of a little bit to remind us today. So as we move forward, can you change the next slide for me, Heather, please? Many of us, as you all know, we're working on so many different levels, but we wanted to check in with all of you for a few minutes is, what are some of the feelings that you all have been managing over the last couple of months, and how might you begin to protect yourselves given this current environment? As I was putting this presentation together and kind of really reflecting over the last couple months, I know for me, even today, over the last few days, I've had a hard time sleeping. I am really anxious. I think on Tuesday, I had a little bit of a panic attack. All of that is wellness. And so just wanted to check in with the group. How are we all doing? How's it been for you?
Yeah, this is Ari. Well, I was lucky that I happened to have gone to the panaderia over the weekend and I got some Mexican candy and I had one left over for election night so I could stress eat. I'm like, oh my gosh. Other people were drinking and taking their tequila shots, and I'm like, this is, oh, I gotta eat my candy now. So so that was kind of a little bit of a self-care. But you know, at some point, you know, I'm kind of on both sides where watching and knowing is helpful to me, what's going on, but at the same token, you have to at some point turn it off, rest, and disengage from the drama and trauma, and be able to talk about it with other people. So
Right. Thank you for sharing, Ari. So I want to ask, El Dulce, did it have chile in it too? You know how we have those
no.
mixers? But it's, I'm asking because as we go through as we talk about looking for comfort, one of the pieces I want to say is that we often go back to what we know, as you said, right? The cultural context of what is comforting. So gracias for sharing. Anybody else? How are you managing this? I see some comments, if somebody can help me. It says, I've been having minor headaches and I just realized it was.
For your request, I'm referring to this email.
I'm sorry? So again, some of us are having these, physiological responses to all that's been happening, right? Anybody else? Turn on your mic, please, if you want to share.
Dan from Juana. Juana, would you like to speak?
Sí, hace como semana y media tuve como una crisis de ansiedad. Eso me generó una migraña terrible, que ocasionó que mi hija se asustara tanto que le tuvo que hablar al 911. Estaba tan mal que cuando abrí los ojos, lo primero que vi fue la cara de Ari y me dice, aquí estoy. Y le digo yo, ¿y usted cuándo llegó? ¿A dónde va? Ok, pasé todo el proceso, fui a emergencias y todo, pero me he estado refugiando, enfocando en trabajos de arte para sentirme un poco bien, porque esta situación ya es para mí caótica, porque las noticias, el social media, todo eso está generando bastante estrés y para mí en lo personal no es bueno.
Sí, sí.
Las condiciones médicas que tengo, pero es algo que si me enfoco más en el arte, creo que voy a poder superarlo y dar ese paso hacia adelante.
Okay, gracias, señora Juana. I'm going to respond in English because I don't know what's the translation capability, pero gracias por compartir y yo sé que por eso es importante tener estas oportunidades de poder hablar y compartir y saber lo que nos está ocurriendo emocionalmente. I was just mentioning as she reflected on her own experience of living in this chaotic, traumatic experience where she's feeling anxiety to a point where she's had to ask for help through her family member, that many of us, it's not uncommon that we're going through this, right? And we're often not always seeking help for ourselves. And so all of these pieces that you are talking as a community are so relevant, not only to the families in which we work, but even to ourselves in order, how do we manage those experiences to come forward for ourselves? If we can move on, Heather, for this. At the next one, the reality is that many of you are mentioning that all that you're seeing on TV, the racism, we've had fires, we've had natural disasters. We all know that this is very overwhelming and yet very natural, very common for us to experience these feelings, right? The increased stress also causes fatigue. It's having an emotional reaction to our bodies, right? An inability to concentrate, perhaps, much more irritable. So all these, we use the word stress a lot, but that is mental health, right? Those are kind of common, whether you are working directly in the community or organization, all of us are going through changes, working environment, etc. So the reminder of that, if we can move forward, Heather, the direct correlation of the physical and mental health. Now, this slide, I decided to put this forward, folks, not so much to get into a big discussion about the brain today, rather to remind us that why it feels so personal is that there are physiological components in which the hippocampus, right, has memories in our brain from early childhood to today as adults. So we naturally experience or re-experience the trauma we might have had in different circumstances. Whether it's related to racism, whether it was related to a negative experience in seeking services. And it's really important that when we work with families, when we work and show up to our organizations, and we're having these adverse, these reactions about policies that might be changing, practices that perhaps are not responsive to the community, any of that, we have had that experience from childhood, bringing it to adulthood. So the point being is that all our systems work together, right? Because they're emotionally tied to the brain, right? And so I want to just remind us that as we're thinking, and many of us, like I said, work with families, is that there's a physiological component here in which the hippocampus stores our memories, right? And we draw from those. So in this constant state of stress, our brain is physiologically automatically responding with us even not thinking about it, just an automatic response. So I mentioned that because I want to give you sort of a contextualized experience of why you're feeling what you're feeling. Thank you. We can move on. So some of us, as we're talking about anxiety and panic, it almost begins to one more, feel like PTSD symptoms. And we use the post-traumatic stress. In the Kashi group, if we can go back a little bit, in the Kashi group, we've been working on addressing, thank you, post-traumatic stress experiences. How does the program respond? How do we create access? So part of all that we're dealing with community, we ourselves are having to manage as individuals. But I want to also mention that there is hope, like we've been talking about. How do we make linkages with other community partners? And one of the key strategies I want to remind everybody on this call today, because we wear multiple hats, whether you're a parent, whether you show up as your CEO, as I mentioned, whether you're a staff member, we have an opportunity as well during these times to remind us of how can we strengthen our own mental health. And I want to remind us that the circuitry, as we talked about, the physical component, how do we look forward and reflect on, and that means reflection. How do we consciously think about what is going on within ourselves and being able to share that inner experience? Our emotions, we always call them our gut reactions. That is mental health. Not being able to sleep, that is mental health. Overeating or not eating, that is mental health. That results in behaviors. So I think what I'm trying to say here is this idea, it's all interrelated, whether it's health and mental health, it's interrelated. Having said that, I'm going to move forward to the next question. If we can move along. I think this group is going to be challenged with all that we're seeing at the policy level with the new changes of the election. How will we remain engaged, right? How will you remain engaged given all the contradictions of what we're seeing in community? An example, as we said, right now we've all voted. We logically say, hey, we took our vote, and yet there's already a lot of litigations taking place. Again, these contradictions, how will you engage? So I'm gonna stop for a minute and just kind of give us a chance to kind of ponder about that. How will we engage in this current time? And what role can you play to promote mental health? So anybody want to share a little bit on that before I turn it over to Dr. Partida? How will we engage, folks, with this kind of contradiction, right? Everybody's feeling going on empty, right? There's this need, this contradiction. How will we continue to engage doing the work with the Kashi group? Heather, you've been mentioning a lot about the next steps. How will the team move forward, right? Where would we find our energy with that? It might be a big question, but for us to kind of reflect on that, I think that's where I'm struggling with as a leader, as a supervisor. I constantly find myself struggling with engaging the staff. I have been at homes for the last 6 months trying to work, and yet how do we help people in community? So the engagement component is very, very challenging. For the purposes of time, the other piece that I wanted to kind of invite people to think about is, what is your role? How might we think about mental health in the work that you do day to day? How might you think about always mental health as a practice in the organizations that, in the programs that you're leading? And I know I'm fast because I want to make sure that we get to the sort of what we want to share with the Department of Mental Health as well. Somebody has a question?
Yeah, hi Leticia, this is Pamela with Eastside Leads.
Thank you.
No, thank you for this presentation. I just want to share how to remain engaged, or what could be our role. Yeah. So I am very fortunate to organize in different spaces, including Eastside Leads. And one of the things that our coalition has done from the beginning, huge part because of our partners who are part of our coalition, like Self-Help Graphics and Actolay, has been to do cultural practices or art components. During this pandemic, of course, like many of you, we haven't been able to meet in person, but very recently this month, because of Day of the Dead, we did. A few members, we decided to go out into the park, be as social distance as possible, take precautions. But the mere act of going out and doing an activity like Flores de Papel or Papel Picado, or even more recently, creating posters for actions in community outside, the comments that I hear from members and from fellow colleagues has been, it's so great to just be outside and do an activity that takes us away from the screen, from the phone. And yes, again, all of us abiding to health, PPE, social distance, right, and practices. But I just want to share that this month especially, that's been something that I've been very lucky to be around in. And I'm just offering that even that change in our routine has been very important.
Thank you so much for sharing that, and it's a beautiful and lovely, full of energy example where sounds like you also drew upon the cultural context, right? Be able to redefine and find that energy again to connect with community, as you said, to also celebrate what's so important, in this case, El Día de los Muertos, right? And so it almost seems like at times have an opportunity to recreate. So thank you. And you use the arts as a way of connecting with community or reconnecting with community. Gracias. Anyone else?
I want to comment.
Okay. Yes.
This is Cecilia from the Wellness Center. I am the healthcare advocate at the Wellness Center, and I teach a chair yoga class and a walking group. I also do wellness checks. I call people up and check and see how they're doing. So many times in my job, it's very rewarding to hear people how they're doing. Just listening to them helps me a lot. And I just listen to the people, and they appreciate just having an ear to hear them out. That comforts them too. So I'm very fortunate to work here.
Great, great. And again, I think I'd love to be able to hear more stories. I want to invite you to share your stories as a community. And today was to bring that, right? Because we are all doing, I include myself in that sense, the best we can. And so to begin to feel re-energized a little bit, whether it's to listen or to participate, I guess the message that I want to, if there's anything you walk away with me from today, is that our mental health matters today. And we have other resources, including myself and other agencies that are working together. We too need to say, hey, I need help too. I need to do this. I need to sort of heal my own heart. And having said that, I'm also going to invite now, for the purposes of time, Dr. Partida, to share with a little bit about what we are doing in the department and what we're doing with community, so you also get kind of a big sense. And if there's time after, I'd love to hear a little bit more about other strategies that the community is using, if that's okay. So Dr. Partida, and we will turn it over to you. Thank you.
Muchísimas gracias. No sé si me pueden ver, pero
yes.
Creo que, bueno, de cualquier manera, Just want to say it's wonderful to be here with you. Es un gran placer estar aquí con ustedes hoy. Yo soy el Dr. Jorge Partida. I am the Chief of Psychology for the Department of Mental Health. Soy el jefe de psicología para el Departamento de Salud Mental aquí del Condado de Los Ángeles. So I want to just talk a little bit about what my role has been. My role as Chief of Psychology is to assure that all psychologists in the department are working to the scope of practice. So in other words, being the very best psychologists that they can possibly be. And so to that end, my responsibilities have really been looking at the emerging and changing role of psychologists within the department, right? We have a Department of Mental Health that oversees the care of 11 million people across all 8 service areas of the county in a very diverse demographically and linguistically variant population. And so the traditional psychological model of care where we sit down with somebody and provide 45 minutes of session doesn't really work. We have to be we have to be flexible enough and innovative enough to really insert ourselves as the height of practice of clinical care in a department that oftentimes has a tough time understanding the linguistic and cultural needs of a very diverse community. And so that has been my focus, is to really kind of just think about not only how can the discipline of psychology reinvent itself in these challenging times, but also I think as a department, really, what is the role of the Department of Mental Health in a population and setting that has to think about innovation of mental health care in a population that is not very traditional. This whole notion of mental health, I think, for all of us has to really be rethought. Mental health is not something that we provide to the chronically mentally ill, to the persistent and severely mentally ill. It is a right for all Los Angelinos to be able to access care, and for the department to really think about ways that providing good mental care prevents a severe and more persistent needs for higher level intervention. So the idea of having infrastructure that really provides prevention, early intervention, education, and information at the level that the community needs is really critical for us to have a thriving community. So that for me is really critical, very important work. I am also honored to let you know that I've been placed as the lead in the expansion of the Promotores de Salud Mental model, which is part of what Elise was alluding to earlier with Supervisor Solis's motion to expand the model to all service areas in the county, but also to other underserved communities. So we take that responsibility very seriously. The Promotores de Salud Mental model in LA County has only been operating countywide for a year, and yet in that time, it has some really incredible outcomes that the Board of Supervisors has requested be made available to other underserved cultural communities. And so to that end, historically, the communities that have been underserved in LA County have been obviously the Latino community, but with the stress and tension going on, the African-American community, the Asian Pacific Islander community, and the Native American community. So we are diligently working on not only helping identify core competencies of the promotor model, but also thinking about how to make that model accessible and how to make that model culture and language specific to fit the needs of other cultural groups. So we've started to have grupos de concientización, which are very much based on the Paulo Freire pedagogy model that looks at public education, that looks at empowerment theory, getting people to identify their own solutions, getting people to identify their own need for care and defining what the cure is for themselves. So that's something that we've started to do with the help of UCLA, the Hispanic Neuropsychiatric Center of Excellence, which has been hired to assist in the development of this training model. So we're very excited to do that. As Elise also mentioned, the funds, the care funds, are to be expended by December 30th. We have over 150 people to hire by December 30th, not only hire them, but get them deployed, get them trained, and get them assigned to the various culture and language diverse communities. So it's a huge, huge challenge, but also a wonderful opportunity for us to really take this one-time funding and to use the platform of COVID and the challenges that COVID has presented in accessing care to really think about expansion and service of the community in a very, very different way than we ever have before. So, so the future of collaboration and opportunities, I do think that we're at a threshold of thinking about what the future of mental health does provide. And there's, for me as a curandero and as a psychologist, the whole notion of really identifying care from the community perspective is really critical. The community has to participate in identifying not only the ills that it faces, but also in identifying the culture and language specific approaches to that healing. We have to be a part of the solution instead of, kind of having an oppressive system, a top-down model that really dictates not only the diagnosis, but the treatment that is needed for the population. So we're in that challenge, I think, right now. I think that, as my position as a manager, but also as an immigrant in this community, often I often feel kind of caught in the middle of those two bridges, but I do think it's really critical for us to begin to think of ways that we can extend the relationship and the inclusion of people who traditionally have not had a voice in participating and in identifying their own solutions. So that, I think, is going to offer a great deal of opportunity in the department, not just to collaborate with Native groups, with communities, with solutions that are culture and language specific. It would also give us a great opportunity to really think about what is meant by mental health, or what is meant by a balance and a balance of mind, body, spirit in a manner that can really kind of keep us from falling through the cracks and becoming statistics or becoming tragedies in the county. And so this is a great opportunity. I think that, the recent political climate and the social tensions that we've seen around that really force us to think about the need for a changing paradigm, where these difficult conversations and these difficult dialogues around oppression, a lack of access to care, a lack of inclusion and equity really have to be brought to the forefront of conversations, allowing people to participate in identifying their own solutions. So it's a very exciting time. I think it's a time where we all feel a great deal of pressure. We all feel a great deal of tension. But I think that out of that crisis is really the seeds of opportunity, the seeds of innovation. I do think that the future also will continue to expand upon the gaps, not only in technology, but in terms of professionals that are educated and qualified to provide care, that have the license and that have the credentials to be able to deliver services, the medical staff, all of that. So I think that the Promotores really offers an accessible, community-based model that can still deliver quality care and can still deliver quality services, even in a time when the future trends dictate that we'll probably see a shortage of health professionals. So it is a very innovative model. I'm very proud to be a part of this expansion, and it'll be a wonderful opportunity for us to really bring more community into employment and more community into participation of solutions for wellness and care. So I'll stop there. I know I've kind of thrown a lot of stuff at you, and see if you have any questions for me.
Ari,
Yeah,
you
this
see raise your hand.
yeah.
Go for it, Ari.
Thank you. Thank you. I appreciate your work and innovation on this. I have a couple of questions and a challenge. One is that we call it, I know you said promotores, but I think that you meant promotora program, because it's usually a women and a women outreach program, women being caretakers of the family. And so my question really is about, what are we doing to outreach to men? They are typically not ready to go, they don't go to the doctors, they don't talk to, professionals about their needs and their concerns. And so there may be some sort of a promotor program that we need to design, where we actually go to men where they work, in their space where they feel comfortable, and so that we could start to address those concerns and their mental health concerns that they probably are not even talking about at home. My second point is around, right now, you mentioned the December 30th deadline. And so I'm like, okay, how would we go about that? And I think that one of the challenges or idea here is maybe the county of LA is one of the the largest employer in the area. So what internal programs can be rolled out immediately to reach out to individuals who work within the county to address these issues? Secondly, on that is contractors. And I know that my company is a contractor to the county, and I was getting an email about the census program. So I think it's really kind of along the lines of the census, where we need to ramp up very high, get some action, and then, it comes back down. But, we want to be able to leverage this opportunity to do outreach, but also tie people to long-term resources. So just, wondering your thoughts about what could happen in that vein.
Okay, thank you so much for your comment and wonderful observations. I'll take the first question first, and that is the use of the term promotores. I'm intentionally using the term promotores for plural, non-gender specific component, assuming that it includes both promotoras and promotores within that label. But you're absolutely right in terms of the gender disparities. Most of the efforts, the professionals that are part of the official title Promotores de Salud Mental program are women. They're promotoras. And the recipients of those services are also promotoras. And yet we do recognize that, often in the Latino community, the men have higher incidence of substance abuse, domestic violence, that they're heads of family that often are not receiving care at a time that could really make a huge difference for them personally and family wise. So that is a huge need. Typically men, and you see this also in the social worker field, in the psychology field, that it tends to really attract more women than men as a profession. So that's certainly something that we have to think about, is what is the disparity? And that disparity is most obvious in the Latino community, where men just really have a tough time, coming to the table and talking about these issues. Having said that, we do have experience with models in the Bay Area, for example, with a program called Los Compadres, which really was able, through part of the promotora movement, bring men's circles and begin to just focus on specific men's issues. I think that's going to be, something really clear for innovation. The second part of your question, there are other initiatives that are going on, as Elise had mentioned, that are parallel to this project. So the funding of CARES dollars also includes outreach of the promoter model in public health. There's also a component that is available specifically for legal entities, for contractors, that is also happening at the same time. So this little piece of the puzzle, this little piece of the pie is specific to DMH, and it's specific to bringing promoters, health promoters within the department, not only for the promotoras model, but also for other cultural linguistic model expansion. So, you know, in some ways we're kind of competing with ourselves, because we're also opening up extension of the model to legal entities. We're opening it up to public health. There's also, my understanding, there's also a community ambassadors program that is a part of this expansion. So I think the bottom line is that the Board of Supervisors and the county recognizes that this level of outreach, community outreach, has been effective and should be made available to as many people as possible. So I look forward to kind of figuring out how to collaborate more fully and how to make sure that, you know, we're able to integrate all the various aspects of this expansion. Thank you for your question.
Yeah, I have a quick follow-up, if I may. Since we just met, I want to identify myself as an part of Latino Equality Alliance, which is an LGBT advocacy organization. And so from that perspective, I wanted to highlight, one is that, you know, we often face medical services that are not culturally sensitive. One, so I want to make sure that that's a component of what you're doing. But the other issue, which is kind of interesting to me, is that this whole thing about testing positive for COVID, people are being secretive about it. Mm-hmm. And I think that's a takeoff from the HIV, because, you know, when you tested positive for HIV, number one, it, you know, back in the day, it was terminal. And secondly, it outed you. So it wasn't just about your health status, it was really about your sexuality and so on. But that's not the case in COVID. And so I think that's something where we need to do some more promotion and health information to let people know that the safer thing to do is to share your status with people.
Yeah, absolutely.
Absolutely. And I think that's if I can also interject a little bit here, it's a wonderful comment, Ari, because I think that even today's discussion in this segment was really also to sort of crack open a little bit that pathway of the importance of how mental health has these different layering, right? Not just, and today this personal connection, but it has everything to do with it, with health, right? And I think we have a wonderful opportunity to further move the needle on stigma, because it's all around us, whether it's like, I think Marta was earlier talking about her involvement in the, you know, with disseminating information. So that theme, and for all of us who are involved directly, to become that much more intentional around mental health. And so just want to also mention before I know Heather's probably saying we have to get out, but I want to just really encourage folks that there is, and Heather will share the slides. Many of us are already familiar with the 800 number, the hotline for the department, but we also want to mention that the department also launched a second line where the intent was that all the community folks can call and speak to somebody. We're working with our partners at UCLA to sort of have a warm line with that. So the minute you call the 800 line, you can ask to speak to somebody. And I just kind of full circle, because we all need support, right? And the idea that myself being involved with your group and what have you is another way of bridging, I hope, and Dr. Partida coming forward today as well, that you begin to attach faces to the furthering our collaboration so that we can strategically address some of these themes that I think constantly many of us are passionate about, right? In helping community, helping ourselves. So with that, I just wanted to mention, coming back to full circle to our well-being. Thank you, Dr. Partida, and I'll turn it over to Heather, if that's okay.
Thank you so much, Leticia. Thank you, Dr. Partida. I think this is really just the start of a conversation, obviously, that we would love to continue further. We hosted, you know, through the Health Innovation Community Partnership, we hosted 6 community listening sessions in 2019, and we heard the need for local community health resources for all age groups, for all individuals, was such a priority for the community. And I want to, we don't have youth participants in this group right here, but the youth also came forward very loudly saying that they too needed mental health resources. And I think that was before all of the crazy changes of 2020 had even hit. So I'm so grateful that this CARES Act funding is being used as a platform to build capacity, to build a platform and a movement to bring, mental health resources and to bring, peer support networks into the local community. So thank you so much for sharing with us. We will be delighted to have you back anytime to give us further updates as these programs develop. I know this is a great priority to all of us. I did put the link and the phone number in the chat for anyone. And of course, we do share materials to all.
Thank you. Thank you so much for the invitation. It's wonderful to participate and meet you all virtually. So appreciate the opportunity. Thank you.
Thank you again. So, well, we are at the end of our meeting today. I wanted to do two things. The first of which is we are still having an open poll for all members of the HICP. You can click through. Dalila, if you'd be so kind as to possibly put the link in the chat, if you would. We're asking for your input as to subject matters, speakers, ideas you would like to explore more deeply in 2021. Our fabulous co-design committee is meeting together after every meeting to design and craft the next agenda. And we want to make sure that we're addressing the needs and conversations you are most interested in having. With that, so I invite you to please click through on the partner survey link. We will share it in the chat and we will send it out via email after this meeting. And that will really help give us good guidance for next year. Next up, we have our meeting poll. Next up, we have just the announcement that our next meeting will be on Friday, December 4th. We're very excited. We're going to be having some presentations on homelessness, housing, and transportation. So this was really a focus on health and well-being. That will really be a focus on kind of the most vulnerable in our community and the infrastructure elements that are also being developed to help meet those needs. So we hope you can join us on 4th. And thank you again for joining us here today and spending such a quality time with us. And thank you again to all of our presenters, of course, for such a rich conversation about how to remain healthy and well and meet the needs of our community. Any final thoughts? Oh, here's our poll. Please share your feedback on today's meeting. All right, everybody. Well, with that, stay strong, stay positive, practice some wonderful self-care for yourself this weekend, and be ready to rejoin the efforts and actions. You're obviously invited to participate in the movement tomorrow, and I'm sure we are all looking forward to some really, really hard work in the weeks ahead as we bring these amazing CARES Act programs to fruition in our communities. I am so grateful to have the chance to work with all of you on these wonderful initiatives. With that, I think I will say goodbye and God bless to everyone, and have a wonderful rest of your Friday.
Thank you, everybody. Bye.